Okay, wonderful. So maybe we'll give it another minute for everybody to join us, and then we can start the presentation. So
I was just wondering, Helena, there's points where we would want to kind of open it up to a wee bit of discussion. Would that just be a case of people opening their microphones and just saying their thoughts, or how would we
it's
share?
up to you. It's up to you. I mean, it's really up to you if you want to let people just talk, in a nice way, in an organized manner, or if you prefer to have all the questions at the end of your presentation to have a discussion, because I'm sure there's going to be a lot of questions. This will provoke a lot of questions and challenges that we face as physical therapists treating patients in very challenging situation.
Super.
So what would you prefer?
I don't really mind. I was thinking, Sharon, because there's a chat option, isn't there, on Zoom? It's been a while since I've used Zoom.
Yes,
so, for example, if I throw open a question, Sharon, if people want to type or speak, then if they type, then you could let me know if they've typed things in and vice versa.
Yeah.
Yeah, cool. And is it a wee hands up comes up like the same as? Yeah.
Yes. So, I'll do a quick introduction, and then I'll hand over the presentation for you, of course, and we'll just ask the participants, anybody is participating today, please, you can write all your questions on the chat. That's a great option. And at the end of the presentation, we are planning to have a discussion, and there's room for questions and answers, obviously. So hello, everyone. Good morning, good afternoon, or good evening, depending where you are exactly located on the globe. My name is Helena Silman-Cohen. I'm the education lead of the International Physical Therapist for Hospice, Palliative Care, Oncology, and HIV/AIDS, for short, IPT-HOPE. And I want to welcome everybody to our speakers to this session. I'm very pleased to introduce the speakers to this session. I'm pleased to introduce the presenters for this webinar, Dr. Sharon Blumenthal, who is a senior lecturer in physiotherapy and interprofessional education, and Dr. Hazel Hill, who is a lecturer in adult nursing, and both are from Glasgow Caledonian University in Scotland. The topic of this presentation is teaching end-of-life care, the design of an end-of-life care curricular within interprofessional framework. This is such an important topic, and I'm glad we have the opportunity to learn more about it. So I would like to thank the speakers for providing this presentation for us, and I would like to hand over this to the speakers. So Sharon, Hazel, please go ahead.
Thank you, Helena. So firstly, a big thank you to Chiwi Tan for inviting us to come and do this talk for you, and thank you to yourself and for making sure that everything's been set up for today. So as you've said, I'm Sharon Blumenthal. I'm a lecturer in physiotherapy and also a lecturer in interprofessional education. Now, the majority of my teaching relates to interprofessional practice and teamwork, and my doctoral research and my postdoctoral research relates to interprofessional education. So I'm coming to this with a dual role as a PT and also as somebody who's got a significant interest in teaching people how to work together collaboratively. I'm just going to hand over to Hazel just so that she can tell you a little bit about herself.
Cool. Hello, I'm Hazel Hill. So I am a nurse. And I have a background in palliative care. So for most of my clinical practice, I worked in palliative care, both as a staff nurse and a clinical nurse specialist. I worked in hospices, community and acute hospitals. And I then went on to do my doctoral thesis on how nurses responded to patients' psychosocial needs in the hospice ward. So palliative care and end-of-life care is a passion for me that has stayed with me since I've moved into my academic post, and I've really enjoyed the chance to start learning more about interprofessional education, working with Sharon and the team. So back to you, Sharon.
Thank you. So the purpose of the presentation today is to share with you the process that we're currently going through as we set up an interprofessional intervention around end-of-life care for students at the School of Health at Glasgow Caledonian University. So where are we? We're a university based on the west coast of Scotland, within the UK. We have around 22,000 students across 3 schools. So we have a School of Engineering, a business school, and we have a School of Health and Life Sciences. And within the School of Health and Life Sciences, we have 7 departments which deliver a range of pre-registration or pre-licensure education as well as postgraduate education. Specifically to physio, we offer BSc, MSc and DPT pre-registration and advanced practice physiotherapy, MSc programs and PhDs. But we've also got paramedicine, nursing, occupational therapy and human dietetics, radiotherapy, oncology, podiatry and oral health, ophthalmology, and social work. So actually we've got quite a large base of professional training here. So that's where we are. We wondered if in the chat people could put where they are, just so that we can see globally who is attending the presentation today. So I'm just going to open up the chat. Nigeria, Duton's in Nigeria. Welcome, Duton. We've got Israel, the Netherlands. Quite a number of people from Nigeria, somebody else from Israel. Ireland, not so far. Right, New Zealand, Jacqueline, I think gets the award for being the first away. Ghana. Nigeria. Okay, great. So actually, we're reaching out to people far and wide, and I think the largest number of people seem to be from Nigeria. So thank you all so much for attending today. So why did this work evolve? Why did we decide that this was something that we wanted to do? So in Scotland, we have an end-of-life care framework that specifies that workers should have the necessary knowledge and skills to be able to support both the individuals and their families and carers when they are in receipt of end-of-life care. However, the literature suggests, and a recent meta-analysis in nursing students suggests, that student knowledge and understanding in relation to end-of-life care isn't adequate. And actually, students suffer anxiety in relation to end-of-life care. They're concerned about how they will respond to death and seeing a dying person. And they feel that they have a lack of competence in their ability to support the individual and their relatives and friends during the period of end of life. And they also struggle to actually understand their emotional response. So on the basis of this research, we decided that we probably should look at supporting students in relation to the provision of end-of-life care. So to do that, at GCU, if we could move the slide on, Hazel, we wanted to explore our staff and students' lived experience in relation to end-of-life care. And we hope to then be able to use that information to develop an interprofessional education intervention that would serve the needs of the occupational therapy, physiotherapy, and nursing students at GCU. So to do this, because it's interprofessional, we needed an interprofessional team. So on the project team, we had members of staff from nursing faculty, from physiotherapy faculty, occupational therapy, and we also had 3 interprofessional education specialists. And we did this to ensure that all stakeholders' needs were kind of represented as we developed the questionnaires, for example. So we've said that we want to set up an interprofessional education project, but what are the drivers? Why do we want to do this interprofessionally? Well, looking at the research, it seems to suggest that by teaching students about end of life in an interprofessional context, it improves their emotional and spiritual capability to deal with patients while collaborating with other professions. It also seems to positively impact students' attitudes towards death and dying. It aids students' confidence in relation to communication, not only with professionals, but with dying patients and their families. It gives them an increased understanding of their own role and how that links with other professional roles and an understanding of other professional roles. It gives them an increase or the students' perception about their own knowledge and skills relating to the management of end-of-life situations seem to increase if they have an interprofessional education. And it also seems to be that if they have an interprofessional intervention, then it improves their attitudes to team working and the need to collaborate around end-of-life care. So with that in mind, it seemed to make good sense to actually offer an interprofessional intervention, because the reality is that end-of-life care is delivered collaboratively, it is delivered interprofessionally, and the students need the skills to be able to do that. So when we look at the project methodology, the project is a mixed method project. If we could just move forward with the slide, Hazel. Thank you.
Is that not showing the mixed method slide, no?
Yeah, you are now. Yeah, thank you. Maybe there was a bit of a lag there.
Yes.
We decided that we were going to do a mixed method approach. We were going to do a literature search. We were going to do online surveys for staff and students. That was going to lead to semi-structured interviews, and then hopefully that would pop out into an IPE curriculum. So that was the project. To kind of set the context, Hazel's now going to tell us a little bit about palliative care and end of life. So I'm handing over to Hazel.
Thanks, Sharon. So I think that a key thing to say before I go into this, but looking at the audience that we've got, I'm sure you're already aware of this, that we are talking about a sensitive topic. You know, we've all been affected by death and dying at some point in our life. So we're always aware of having a sensitive approach to this, and we will talk very openly about death and dying because that's what we need to be doing more. So if anybody has any, sorry, my battery, I'm about to run out there, that would have been awful. So if anybody does find this difficult, please just do let us know. So when we're thinking about end-of-life care as a part of clinical practice, we're thinking of it being a component of palliative care. And so what we needed to do was kind of look at what we're actually looking at within end-of-life care. So we asked within our survey what the students meant by end-of-life care. So before we kind of go on to talk about what we found out in our survey, I just want to kind of give you an idea of the background that we were coming from, and an interesting point arises out of that. So you'll all be familiar then with the World Health Organization definition of palliative care, and that was updated by Radbrook and a huge team of people in 2020. And it still looks very much like that definition that we used to use. So it's kind of talking about dying being a normal process, supporting people to live as actively as possible until death, quality of life, the ethical things of not hastening or postponing death. And the big change about what is, I think we'll all agree, is that recognition now that palliative and end-of-life care isn't just for people with a limited number of conditions, but it's for anybody that we recognise as going into that end-of-life progressive illness phase. And the key aspect, which you might notice is missing from this definition, is that it uses a team approach to address the needs of patients and their loved ones. So we've put that in bold at the top because this team approach is the thing that we're focusing on within our presentation today. So Sharon mentioned the framework that we have here in Scotland for managing. I've just realised that my notes are not actually on this copy of the presentation. So in Scotland, we have defined what our role is within palliative care, and it's lovely to see people from across the world on this presentation. So you will all have your different policies and guidelines that set out your positions for palliative and end-of-life care, but we've obviously focused within this project on what our government and clinical experts are encouraging us to look at. So in Scotland, we have this framework, and we'll kind of refer back to that throughout. And what that framework states is that everybody working in health or social care in any form should have an informed practitioner level of awareness and ability to have knowledge and skills within palliative and end-of-life care. And some of us work in areas where we're working a lot with patients who have palliative care needs. So this document encourages that we go on to be skilled professionals. Some of us are working areas where the focus of our care is palliative care, and we should be enhanced practitioners. And for those of us that actually specialise within palliative care, and I just realised I forgot to say this about myself in the introduction, we actually work to an expert level, and I have an expert palliative care practitioner registration with the NMC. So kind of that's, again, partly where my background is. And I suspect that different people from the audience from this group will also fall into that group. So within this framework, there are 5 domains of areas that we need to look at within palliative care. And throughout the document, there's reference to interprofessional working, and Sharon and I will keep linking back to that throughout this presentation. But the 5th of these domains is actually care in the last days of life. And that's what we're looking at when we're talking about end-of-life care. And this slide just identifies what the Scottish Government and Scottish palliative care experts define as things that anybody that's working within health and social care in Scotland should have these skills and knowledge. So I wondered if we wanted to just take a wee minute, if you wanted to have a wee look at them, and if you have any thoughts or comments about whether you feel you have these skills and knowledge, whether you feel when you're working with students, you are encouraging students to have these skills and knowledge. And if anybody wants to come on and actually share their experience or thoughts about this, you could do that if you kind of raise your hand on your participant page, or you could put something into the chat box. So I'm just switching on the chat to see if anybody's putting anything in. And while you're putting in, if you want to put anything in about the chat also, is my pace okay? I'm forgetting that, again, it's that international audience we've got. Or what you can do if you don't have any thoughts about this is we can come back and have a look at this at the end of the presentation. So I'll just move on for just now. Okay, so again, just to remind us about the focus about being interprofessional nursing, it's raising that awareness that all of the organisations, so we've talked about the World Health Organization, in Europe, we look at the European Association of Palliative Care, and they very much talk about the importance of working in teams in palliative care, and that's about continuity of care across a variety of care settings, so anywhere that care is provided, and is working again with that collaborative partnerships. And another example, if we look at the literature, we'll see examples of collaborative working throughout the literature. But this is one that is from the ambulance service here in Scotland, looking at the importance of collaborative working between health and social care, and that it's a necessity. And certainly from my own experience of work, that we really encourage this team working. And again, it'll be interesting to know what, from the different parts of the world, what you're advised on and what information's out there for that. So, end-of-life care, remember we said it's part of palliative care. The definition of end-of-life care is very similar to, so this is the National Council for Palliative Care, so a UK-wide organisation. And they are looking at that advanced, progressible, incurable illness, supportive and palliative care, the last phase of life and into bereavement. So it's that recognition that bereavement is starting for the person who's dying, they're grieving for the loss of their life, and for the people who loved one is going to die, they've got that as well. Sorry, if somebody's got something on and sounding on in the background, is it possible to mute your background? And then the other thing that we see about the end of life care is it is time bound, but the challenge of defining what that time is really difficult. So ideally we're kind of talking hours and days, but it can be weeks or months, and this very much depends on the condition itself and the patient's condition. So we have, in my clinical practice, people that we have thought are going to die within hours and can still be there weeks, sometimes even months later. And that's a challenge that we need to be aware of. But, and this was only something that came up into our minds when Sharon and I were preparing this presentation that we haven't really reflected on, but that I have started over the past few years, including my teaching. We must always remember that in healthcare, we're also coming across people who are suffering from sudden death. So that's a wee side thing that we need to start thinking about. It's not so much about the palliative care because we don't know what's coming, but it is an aspect that we must always remember when we're supporting our students. And again, I just put this wee slide in as a wee last minute surprise to Sharon, just to highlight what are the most common types of death that we come across in healthcare. And these are those long-term ones that we recognise for palliative. We can see sudden deteriorations in conditions, infectious diseases, and then those more sudden deaths of the accidents and suicides. And that we need to be always aware of that, and also bereavement. And that bereavement is not always with people who are currently encountering death and dying, but we could be working with somebody in the middle doing something else, talking about, you know, for you, helping people to adapt and change their way of life. And then that brings perhaps a grief of losing their mobility or something like that. So we have to always be aware that bereavement's an issue that arises for us. These end-of-life trajectories, again, I'm sure that you've all seen these before, but they've been updated to include the sudden death and the catastrophic events which cause that. So what we're focusing in on within this project is that time span within the red box, which is looking at that, recognising that death is coming closer and that we need to act upon that. And again, coming back to the literature that Sharon mentioned, the key competencies that are considered that we must be looking at for interprofessional education within end-of-life care are communication skills, the knowledge of cultural practices and beliefs about death. And if we don't know what these are, there are ways to find out, but also just ask the person if they're capable of answering and their loved ones. Having knowledge of symptom management and that ability to reduce pain, suffering and death, and looking at decision-making, conflict and dilemma resolution. And then just coming back to that key framework and linking nicely into the interprofessional nursing, there's just a couple of quotes, a few quotes from that. So it's important that we have knowledge of how and when transitions in care and support arise between and across services and sectors and settings. So that's really important for us communicating with each other and picking up when we notice people are perhaps moving into that dying phase, that we need to work collaboratively within a range of services and agencies in caring for and supporting the person, family and carers. So again, it's about interprofessional support for each other as well as for the patients. We need to recognise our roles in relation to the organisational policies and procedures when a person dies. And we need to reflect on and recognise our communication skills within end-of-life care and know when we are maybe reaching our limits and we want to get support to meet the patient and their loved one's needs, but also develop our own learning. And that links nicely into the IPE framework, which Sharon is now going to talk about. If that slide has come
Thanks,
up.
Hazel. I was still on mute, still haven't worked out how to unmute myself in time after 3 years of doing online education. Thanks for that. I suppose the key things for me in terms of what Hazel said is that there is this big push for us to be able to communicate interprofessionally, to be able to work with others, be able to work across settings. And we're doing this to provide the best and most effective care to the individual who is dying, and also to their relatives and carers. If we can just go back, Hazel.
Yeah, I don't know, that just jumped on automatically. I don't know if we've got some time.
Thank you.
Sorry.
Now, I don't know about your education, but certainly when I trained, which is a long time ago now, was very much thought that we would learn these skills of collaboration also almost by osmosis. And the reality is that doesn't happen. And we know it doesn't happen because we can see that through medical errors that are, usually occur because of team breakdown. Certainly in the UK, we've just had a big report out from midwifery services that talked about increased deaths in babies, and this occurred because teams didn't work together and there was poor leadership. And there are many reports that you can see that not are just UK based, but actually globally, that tell us that there are issues with teamwork within health and social care. So interprofessional education is supposed to help with that. So IPE occurs when students from 2 or more professional backgrounds learn with, from, and about each other to enable effective collaboration and improve health outcomes. Now, the key thing here is that they're learning with, from, and about each other. That's active learning. They're in the classroom to explore their understanding of each other. It's not just being in the same space. So it's not just having a research methods class and then being physios and OT students, because that's a common curricular requirement. The key ethos is that we are trying to get them to understand each other so that they can work together more effectively. Now, it's been purported by the World Health Organization that actually IPE is a necessary step for us to actually work collaboratively in practice. It stops us teaching students in silos, because if we teach in silos, when we come out into practice, we work in silos. And what it aims to do is it aims to enable us to work together collaboratively. So Hazel, if we could go to the next slide. Collaborative practice occurs when professionals from different disciplines work together with patients, families, and communities to deliver the highest quality of care. And that's ultimately what we are trying to do with IPE education. Now, in the UK, IPE education is mandated to be included in our curriculum by professional bodies, from any professional body of students that are studying health and social care. So it's a mandate from the Nursing and Midwifery Council, it's a mandate from the Chartered Society of Physiotherapy, the Royal College of Occupational Therapy, the General Dental Council, the General Medical Council. It has to be included within our curricula. So in terms of if we've got to provide interprofessional education, what competencies, what are we actually wanting students to kind of achieve, or graduates to achieve? So there's 4 key competency frameworks globally, one within the United Kingdom, one in Canada, one within the United States, which is stated on this slide as being 2011, but it's been updated in 2016 and it's been refreshed and will be republished again in 2023, and one from Australia. And what's interesting when we look at this, there are key things that come out within the capabilities or competencies. And they are things such as team function and being able to work within a team, understanding other people's roles, being able to deal with interprofessional communication and manage conflict. So that's what we're trying to achieve in our students by teaching them interprofessional education. We can go on to the next slide, Hazel, please.
Yeah, that should be it there now.
Thank you. So in our framework at GCU, which I'll tell you about in a minute, we have a number of competencies that underpin it. And these are supported in recent literature. So these are around role understanding, my own professional role, and how that fits with other professions, and actually develop an understanding of other professions so I know when to involve them when working with clients in practice. The ability to communicate interprofessionally, that's actually more challenging than we think, because we've got our own cultures, values, jargon, and that can actually cause misunderstanding and breakdown in communication. We've got to have the right interprofessional values. We've got to respect and trust other professional groups to be able to work with them. That we need to make collaborative decision making. We are all going to have different priorities, and somehow as a team we've got to decide, and that team includes the service user or the patient, what is the biggest priority and how do we work together collaboratively to make the right decisions. We've got to be able to reflect on our practice in relation to team function and work out what's gone well and what hasn't gone well, and what's, you know, what have we done that have contributed to that team breakdown. And we also need to understand a little bit of theory about how teams function and what the challenges are that they face in interprofessional context. So that could be things like identity, culture. It could be barriers, just basic barriers to teamwork, such as not having a shared vision, for example. So understanding a little bit about the theory about the challenges and the facilitators to teamwork. Hopefully our students can apply that to their practice. We could go on to the next slide, Hazel. So as we've kind of identified at GCU, we have a number of students, social work students, allied health professional students, and nursing students in the UK. Nursing students are split up into branches. So we've got adult nursing, child nursing, learning disability nursing, and mental health nursing. So we have a large student body. So for us, it makes absolute sense to have interprofessional education at the core of the education that we provide to these students. So if we can go on to the next slide. Thanks, Hazel. So IPE, we have offered at GCU since 2004, and I've actually been involved in it since 2005. And I've been the lead for the IPE framework, which includes things such as strategic development since 2021. Unusually for IPE, could just go back, Hazel. Unusually for IPE, our framework is credit rated, it's mandatory. So the students have to do it, and it's a 20 credit rated module, for example. So a lot of IPE that you'll read about in the literature is voluntary, and you know, it's a short-term intervention. Our students do 20 credits. Run. Oh, somebody's got their microphone on. Don't mind just turning it on. Okay, I'll try and talk over it. So yeah, our students take modules of 20 credits, and they run over 12 weeks, and they will run in the first just unmuted myself. Yeah, so our modules are credit rated. They run for 12 weeks in year 1, 2, and 3 of our undergraduate curriculum. Our IPE framework runs across 2 universities, us and Strathclyde University, and it's quite big. And this is one of the barriers to offering credit-rated IPEs because of geography and timetabling, but we've managed to circumvent that. And we've got about 4,500 students that move through our framework every single year. And we have 150 tutors that contribute to the delivery of those modules. And it's delivered to all of our pre-registration, pre-licensure students at undergraduate, BSc, MSc, and doctoral level. We can go on to the next slide, Hazel. So the way that we deliver our interprofessional education, we follow the University of British Columbia model of IPE. And what this is acknowledging that students need education that is cognizant with the stage of their study. So in year 1, when they come in, they are very much trying to grapple with who they are and what their professional identity is. Now, when we come in, our professional identity is often shaped by stereotypes and what we've read in the press. And then we come and we realize that actually what we're going to do is slightly different. So for physio, a lot of students, for example, don't appreciate that they're going to be doing cardiorespiratory care. So in year 1, we want them to develop their uni-professional identity. We want them to meet other students, but we just do that through exposure. So what that means is that we've got them in the same classroom and they are learning generic skills together. So that might be something such as CPR. It might be information handling. It could be things that are important to end-of-life care, such as cultural competence that Hazel has already talked about, and communication. Once they feel a little bit more secure in themselves, then we put them into stage 2, which is the immersion, where they're going to start to work together on specific group activities, where they will face authentic challenges to teamwork. So these could be geography, it could be different timelines, it could be, different timetables. So they have to produce projects and they've got to overcome those potential barriers to teamwork. So that's stage 2, and then stage 3 is mastery. And in this stage, we're actually getting them to run multidisciplinary team meetings, looking at cases. So our students move through a very coordinated framework. And what we're trying to do is move them from the notion of them being, uni-professional identity, I'm a physio, to actually I'm a physio that works in a team. So I've got a dual identity, just don't see myself in a uni-professional perspective. Okay, thanks, Hazel. In terms of the learning outcomes, it's not going to surprise you that these map really strongly to the competencies that we talked about. So our modules focus on making sure that the students understand teamwork and collaboration and the facilitators and barriers to that from a interprofessional perspective. We talk to them about values and ethics and professional identity. If we could go back, Hazel, thank you. And culture and how that could be potentially a barrier to interprofessional practice. We talk to them about communication and communication tools that they might be able to use to improve interprofessional collaboration. We get them to kind of understand their own role. So they talk about their own role in case studies, but they also talk about how that fits with others, and they listen to others' roles so that they get a better understanding of how they fit together as a team. And we also teach them the notion of interprofessional leadership. So historically, the students tend to think that if there's a medic in the room, the medic's going to be the leader. But in interprofessional teams, that's not the case. Anybody can lead. So we talk about interprofessional leadership as well. So that's what we've got in terms of our IPE framework. Going back to the study itself, the first thing that we did was that we developed some online surveys, and these were going to be delivered to staff and students. And these surveys were kind of developed to explore the understanding of the meaning of end-of-life care for both staff and students. Hazel, if you could go on to the next slide, please. They were also there to explore, well, what experience have our students and staff had? Is that professional experience? Is that personal experience? Have they encountered end-of-life care teaching within their curricula? We wanted to explore, you know, how confident are they in their ability to deliver end-of-life care, whether that's teaching or whether that's actually professionally out in practice. And we wanted to explore with the students and the staff, well, if we're going to teach you end-of-life care, what kind of teaching modalities would you like? And how do you feel about using IPE as a teaching method? So looking at the results, 26 staff responded, 18 were from nursing faculty, and 4 were OT staff and 4 were PT staff. And these staff taught across undergraduate programs and postgraduate programs at GCU. So the first thing that we asked them was, well, what does end-of-life care mean to you? So staff identified that it was a process of dying, that it was death itself, and it was the events that were kind of leading up to that. They also identified that it was person-centered care. It was beyond the individual. It was about supporting the patient, the family, and friends as the patient went through the process of end-of-life and death. They identified that it was much broader than the physical side of things and symptom relief, that it was about things such as spirituality, for example, or social aspects. So that came through very strongly. It came through strongly that actually it was time bound. So when Hazel was talking earlier, she talked about end of life being time bound, and it could be within the last year. People talked about the last year or the final hours, days of weeks. And they also talked about people moving through various stages. And I suppose what was good for us to see was that what the staff were saying really strongly aligned with the definitions that were presented by the Scottish Government. Can people still see the slides? Because they seem to have disappeared.
No, we can't see the slide.
No.
Right.
Oh, sorry.
Wonder if
Here we are. Yes.
out. Let me just go on. I will.
No, we can't see the slide again.
Okay, I will just upload them onto my computer. Don't you just love IT? And then I will share my screen. Just give me 2 seconds.
And at this opportunity, everybody who's just participants, can you please mute yourself until we end the presentation, so we can respect the presenters and hear it loud and clear, please? Thank you.
All right. Okay. So Hazel's just said that her Wi-Fi has dipped and she's trying to reconnect. Right. So let me just see if I can share my screen. Come on, share. Right. Let me just see. I can go back into Teams. I don't know where the presentation's gone. Teams. Okay, can you see my screen?
We
Yes,
can
please.
see the,
Yes,
we
we
can see the
can.
presentation. Yes, thank you.
Okay.
Oh, here's Hazel.
Is Hazel back in? Because I can't see now. Okay.
Yes, yes, she's back.
All
Just
right.
a moment, and she's going to join us. Let me see.
Yeah. So the next question we asked faculty was, do you think preparing students to deliver end of life care was part of your role? And actually, the majority of faculty absolutely felt that it was part of their role. Okay, so for example, one of our IT lecturers said that they were likely to be supporting students and patients and families at this stage of their lives. So it was essential that students knew about it. Staff identified, and I suppose this is a key point and why we've put in some of the slides earlier, that end of life care can happen in any setting. Now, historically, we tend to think about oncology, elderly care, maybe intensive care environments, but really it can happen in any clinical environment. So it's important that we prepare students for that to occur. Staff felt they should be taught early because actually it's quite difficult to deal with these situations, and students don't know how to kind of cope with that, you know, from a personal resilience perspective. So we've got a role and a duty of care of actually being able to prepare them to deal with that and how to cope with that emotionally. And that leads into that it's important in relation to student well-being. And then a number of staff talked about this notion of these skills being embedded, because actually a lot of the skills that we will use in the end of life care environment are generic in nature. So if we're thinking about personal resilience for the student, they're going to need that in many environments. If we're thinking about communication, they're going to need that in many environments. So it's actually embedding these themes all the way through the curriculum, which is really important when we've got crowded curricula, because we can't cover everything. But we need to make sure students understand that the skills that they've got are kind of applied to many contexts. The next thing that we asked was, how confident do you feel in terms of teaching end of life care? So some staff, unsurprisingly, felt very confident because actually they'd had a lot of professional experience that they'd be able to draw on in the classroom. But actually a number of staff were either moderately confident or not confident at all. And a number of staff actually identified, well, I can do it, but I'm going to need quite a lot of preparation to get me to the point where I'm going to feel comfortable to actually deliver this in a classroom setting. And what was interesting was that staff not only identified that they weren't necessarily confident in teaching end-of-life care, they were also not confident in terms of teaching these things from an interprofessional perspective. And the quote that we've got up here relates to somebody thinking that if they're in the interprofessional classroom, not only do they have to cover their own discipline knowledge, that they've got to cover the knowledge that relates to maybe a discipline that's not their own, such as nurses. So that to me highlights that there's some educational needs for our team around what IPE is going to consider, because for me it wouldn't necessarily be me in a classroom on my own teaching students about the roles and responsibilities of nurses in end-of-life care. That would have to happen through the nursing faculty potentially. Then we asked, well, okay, so we agree that we should be doing end-of-life care. Do you think actually we should be doing it interprofessionally? And the majority of staff did think that we should be doing it interprofessionally, because actually it would have a positive impact on patient care, because we're not going to treat these patients as individuals. We're always going to be in a team. So actually we need to know who's going to be in that team and who we could refer on to, who could be involved. We needed an understanding of the bigger picture, and that would actually lead to more effective and efficient care for the service user and the family. Staff felt that actually it would give students a better understanding of their own roles and responsibilities in relation to end-of-life care and how that fitted with other professionals, which is one of the things that we're hoping to achieve through IPE. So that was actually a positive outcome. And it also was identified that actually there's often quite a lot of barriers to working interprofessionally in practice. So actually, if we could get the students in the same space, that we might be able to break down those professional role boundaries, and that would enable them to work better together in practice. Not all staff felt like that, though. And there's a quote on this slide that's come that says, well, actually, I don't think it's going to be good because it might be of limited benefit to, in this case, it's nurses. What we don't know is why that is. Now, it may be that this individual thinks that, you know, it's not going to cover the core bits of unidisciplinary teaching that nurses specifically might need around end-of-life care. And that might be why they feel. And that to me indicates that we probably need potentially uniprofessional teaching and some interprofessional teaching to kind of support that, to make sure the needs of individual professions are met. Going on from that, staff identified that they thought if we did end-of-life care, what it would do was increase the authenticity of learning in relation to interprofessional education. Now, authenticity has been shown in interprofessional literature to increase student satisfaction within IPE interventions. And what we mean there is that actually the students are facing an experience that they could see themselves in practice. One of the things that is a problem with our framework is that it's very academic, and the students kind of struggle, you know, why am I learning about the theories of teamwork? It really isn't going to help me be a physio out in practice. So actually, if we could maybe bolt some of the things around things such as end-of-life care, then that might increase the authenticity of the IPE practice. As identified on the last slide, there was a perception that it's not necessarily going to cover all needs. It's not a panacea to provide end-of-life care education for all of our needs. There may be some stuff that needs to be done uniprofessionally before the students actually come on to have the IPE experience. And it came very clearly through the narrative that actually it would be great, but it needs to be done properly. That means it's got to be resourced properly, and it's got to have the right staff. So it's going to need people who are end-of-life experts, and it also needs to have people who can teach interprofessionally. And because interprofessional education, in terms of the teaching pedagogy that sits behind it, if we don't do that right, we can make things worse, and we can increase stereotypes, and we can increase barriers between students. So it needs to be done in a way that we prevent that from occurring. And again, that's very clear in the literature around IPE, that for it to be successful, you need to have faculty that are trained within it. So we've got to consider both these things, that we need end-of-life specialists, and we also need to make sure that the people in the classroom also are comfortable to teach from an interprofessional perspective. We asked staff, okay, you know, what kind of teaching and learning strategies could we use? And you can see kind of what they've responded to. Lectures was the lowest response. We tend not to use lectures wherever we can. I mean, sometimes we have to, because if we're just imparting knowledge, and we've got large numbers, it's the best way to do it. But wherever we can, we try to use active learning. So things such as case studies, videos, interprofessional education, visits using service users example came up very strongly. And a lot of these things could sit very well within an interprofessional education context. And then we thought, well, actually, what we need to do is we kind of need to look at what the literature sort of says about, you know, interprofessional education interventions in the end-of-life care. So actually what we did was a very quick, rapid scoping review. We searched 6 databases. We limited it to the last 10 years. Papers were screened by 2 people, myself, and one of the members of nursing faculty is an expert in end-of-life care. We extracted data using a data extraction tool that was developed specifically for the project. Now, because this is a scoping review, we didn't screen the papers for quality. The purpose of the review was just to quickly map what research identified in relation to IP and the provision of end-of-life care. And we were interested in what professions were involved, where was the intervention, was it in the university, was it in clinical practice, what type of intervention was used, what was the duration of the intervention, what were the study outcome measures, and what IPE competencies were assessed. Now, what came through very strongly was that there wasn't much research that looked at PT and OT from an interprofessional perspective, that it tended to be mainly American research, so the transferability of that to the UK context could be problematic. The variety of outcome measures that were used were wide and vast. And the type of interventions that we used were very wide and vast. So we couldn't be able to say to you, well, this type of IP intervention is likely to be the most effective, because we just don't know. What was clear, that simulation appeared to be very popular as an education strategy, that it did seem to improve attitudes and knowledge in relation to IPE, teamwork, collaboration, and communication. It did seem to suggest that students, through these IPE experiences, developed a greater understanding of their own and other roles. And also some papers looked at students' attitudes towards death and dying using the FATCOD-B questionnaire, and found out that attitudes were positively impacted as a consequence of an IP intervention. So where does that leave us at the moment? Okay, so what we felt was, thankfully, staff understanding of end-of-life care reflected the literature and Scottish policy. Staff were clear that we should be teaching end-of-life care. Staff within the OT and PT programs identified that end-of-life care was not explicit within the curricula, and certainly from a PT perspective, we are reflecting on that and thinking that there's maybe a gap. Not sure how we're going to thread that in, considering that we've got an overpacked curriculum, but it's something that we need to think about. That we do need to pay cognizance to the different needs, and as I've said, IP is not going to be a panacea to meet all of those needs. It's just part of the educational strategy we could use around end-of-life care. A small number of staff didn't feel that they thought IP would be appropriate, and I think when we go on to semi-structured interviews, we might want to unpick that a little bit. That staff are not always confident to deliver end-of-life care or to teach interprofessionally. The literature around the use of IPE in terms of teaching around end-of-life care is positive, but we're at a stage where we don't know what approach would be best. Okay, so I'm going to hand over to Hazel. So Hazel's now going to go over the results for the students.
Cool. I'm really sorry about my Wi-Fi cutting out there. Just let's hope it doesn't cut out anymore. So yes, so for the students, we had 83 students responded. 70% of them were, that's me thinking off the top of my head, I thought I'd written that on my notes, were nurses, 6 occupational therapists and 3 physiotherapists. Now we would have liked higher numbers than that, but actually we think the distribution of the numbers actually is quite representative of our student population and probably of certainly the population of practitioners within healthcare, certainly in Scotland. So we still feel that it's interesting data to have. And there was a mixture of second and third year undergraduates across in the 3 programmes. And we had pre-registration MSc students from all 3 programmes, and we also had district nursing postgraduate students. So it was a nice distribution of students. Do you want to pop on it? That's brilliant, thank you. 70% of the respondents felt that they had learned about delivering end-of-life care during the programme. But what we have to bear in mind that it might be, I wonder actually, Sharon, if I can go back to sharing my screen because I've gone and made some animations. If I just put share screen, will it just automatically go back to me?
I think so.
Oh, wait a minute. Which one have I got there? That one. Okay. Share. Cool. Hopefully that's the right one. Is it? It's still thinking here. Screen sharing. I'm looking for the blue line around the screen. That's the wrong screen, isn't it?
Yeah, we can see the Zoom.
This one. That's it. That's the one I want. Okay. Share. There we go. And can you see that now?
Perfect.
Perfect, brilliant. I've lost my Zoom page, but that'll come back. I don't need that at the moment. So yes, so 70% felt that they'd learnt about it, but we need to bear in mind at this question level, was that theory? Was that practice? Was that both? And that's something we'll go on to explore further when we actually have face-to-face interviews. And the physiotherapy answers suggested a similar response. With one physio saying yes, it wasn't as similar a response, and we'll come on to kind of talk about this. So this is reflective that perhaps it's to do with that difference between academic learning and practice learning. One of the physiotherapists we'll see later had experience in end-of-life care, and the other 2 in practice didn't. So it's looking at the comparison of that. So across the disciplines, the students felt that end-of-life care should be part of the programme. It should be vital to learn about it from day one, said one of the students. But the problem is that theory doesn't always meet up to practice, so nothing can quite prepare you for that first experience. However, a good thing to know is that the theory that we did provide, they do seem to feel that we had a sensitive and appropriate approach to that. And there was one specific physiotherapy comment that looked at the programme, and they're saying they didn't feel it was covered at all during the course, and they felt underprepared if they came across it within practice. So there is definitely a demand out there that we need more of this kind of practice. Pulling together again, a lot of the questions across both of the surveys were very similar. So we asked the students also what end-of-life care meant to them. And there was a variety, a huge amount of qualitative data kind of came out of that, and we've pulled it together in this picture. So there was a range of definitions that I feel reflect people's understanding very much of palliative and end-of-life care as it stands. So a lot of the students, when they were giving the definition, it was that definition of broader palliative care. As we've looked at earlier on today, they are very similar. And that ranged to the opposite of some people, well, very few, but one in particular saying nothing else can be done. And whereas what we would say is there's always something else can be done. If it's about making a peaceful death, and if it's about supporting people, the loved ones, to go through the dying phase and bereavement as best as possible. And they recognised that it was to do with certain types of illnesses it might be more common, that it's about a loss of independence and a need for support for everybody. The actual definition that they came up with really is that end-of-life care is the provision of person-centred, holistic care to enable individuals to have comfort and as little pain as possible. We'll go back to that slide. And dignity up until and after their death. So bringing in that care immediately after they die, and that the support should be inclusive of their loved ones. This care involves valuing life and individual wishes until death, bereavement care, preparation for death and dying, communication, and support for and amongst professionals as well as for the patient themselves. And thankfully, because this was a key aim of the study, they did see the importance of interdisciplinary liaison and support. So these definitions are quite similar to what we have in published definitions, and also represent the common confusion about what end of life of care actually is. In the bottom left, in the bottom right corner, you'll see COVID was mentioned. So understandably, with the timing of the studies, that was quite in the forefront of people's minds still. But I would like to hope that we would have come up with the same definition had the pandemic not occurred. And then some students in this question also looked at how it feels for them personally. And there was a range of answers from that, from it being a privilege and an honour, to one student who felt that end-of-life care was a sad thing to have to deal with, which it is, but hopefully it's a comforting thing as well. The physiotherapy answers alone reflected much of this, and are summarised by providing comfort to patients and families to give as peaceful and pain-free a death as possible with as great quality of life. So the definitions matched across the professions. When we asked whether they had knowledge and understanding of other team members' professional role in relation to end-of-life care, 77% of the students felt they did. And the physiotherapists themselves, it was a variety there amongst the three of them, with one not being sure, one strongly agreeing that they did, and the other agreeing that they did. We haven't been able to explore that further at the moment, but again, that's one of the key things for our interviews. And we had, at the end of the surveys, we had a couple of questions that allowed them to just give us any questions. So one of the students did actually clearly say they'd like to learn more about the multidisciplinary team and the roles. So a wee bit of teaching in there, looking at interprofessional rather than just multidisciplinary. Whilst another one commented that they'd had a week of learning about end-of-life care, but it wasn't in relation to interprofessional teams. This was during a different module. So what happened in that scenario, I can definitely say that that would be a nursing student, and they had a module that was running at the same time as their interprofessional teams module that was looking at long-term conditions. So in that, there was a week looking at end-of-life care, because I know because I was involved in writing it, and at the same time they were doing the interprofessional. So they're raising the point there that they would like them, to me anyway, I'm saying they're raising the point that they want them to join together. Oh, I've gone backwards there. So when we asked them whether they'd been involved in the delivery of end-of-life care when on placement, 70% said that they had. However, this is skewed by the high number of nursing students, and only one of the physiotherapists had. 13% of the respondents had encountered end-of-life care elsewhere. And that is a good thing that they picked up on that, because again, that's them noticing that it's not about the speciality of end-of-life care, that it's happening everywhere. And many expressed a desire for specific end-of-life care placements, which actually may happen more than they realise if we think about the broader range of end-of-life care areas. But having specialist palliative care placements for all isn't a realistic aim because of the number of students that we have and everywhere else, and the small number of specialist palliative care units. But again, it's about us thinking more broadly and thinking when we're working with our students, what opportunities can we give them when they're out on placement? They were wanting that it would be beneficial for their knowledge. So we need to make that bigger effort. Oops, I've done it. So only 13% of the respondents felt that their end of care placements included students from other professions, with a further 4 being unsure. And that unsure thing is something that jumps out quite clearly, that we'd like to explore further, because the question that arises from this is, when students are on placement, are they really looking out for other students from the other professions? Are they being encouraged to work together at that stage? So we need to be thinking about that as well. Because, for example, physiotherapists and occupational therapist students, I imagine, on most placements are going to different geographical areas, even if it's just different wards within the place, whereas the nurses tend to stay in 1 or 2 places. So we need to maybe be looking at insight visits and what we can do there to bring that on. And we did actually have one example that was a specific physiotherapy perspective. So I thought that that was important for you to see that. So I'll just give you a wee minute to read that while I have a wee drink of water and check. There's nothing in this chat I need to check. So it's excellent here in this quote that the physiotherapist is recognising the value of end-of-life care for them. What we need to do is try and get more physios, not more physios, just everybody across the board to have a greater interest in that. We also looked at confidence for students. So we feel that 4 of the questions that we asked were kind of looking at perceived levels of confidence and kind of giving that difference between confidence through their academic learning and about their understanding, to confidence about actually providing care and working with other people. So students seem to feel they had a reasonable understanding about what end-of-life care, but they weren't as confident of actually providing end-of-life care and working with others. 2 of the physiotherapists disagreed that their academic studies made them confident, whilst 1, the undergraduate student, agreed that their studies had helped them. So that's maybe something to look at, maybe comparing the programmes when we're looking at the curricula again. So also this is just some quotes to give some more insight into how it feels for students to be involved in end-of-life care, so that we can be aware of this when we're educating them and supporting them. So I fully believe there is such a thing of a good death. I understand the importance of discussing end-of-life care before it reaches the point where family have no idea what the patient's wishes were. And that's great that a student is thinking that and thinking we can move forward to it. There's an element of end-of-life care that's very difficult to describe, a sort of beauty that's hard to put into words. And you know, I wish I'd seen this years ago, because the number of people that go, oh, that must be very difficult, when I tell them that I'm a palliative care specialist. But I think we should try harder to articulate it so it sounds less daunting and scary to students. But we did have some comments that were the opposite of that, and basically saying the theory made it sound like it wasn't daunting, but actually the reality it was. So here we go. Although the theory is great for learning, it does not prepare you for the emotional impact that the practical learning provides. Reflecting on my own experience in placement, it feels like a privilege to be with someone. So at least that's them saying their academic theory might not prepare them enough, but they're still feeling it's a good thing. And then it's that bringing in, trying to bridge that gap between theory and practice. It would be good if the university and placement areas offered more support and public counselling, because it can be very traumatising. So we need to be thinking about all of these and how we can support and educate students. 95% of the respondents felt that collaboration with other members of the multidisciplinary team and attending a placement when they would be working with other professional students would be of value. So that's great. That's telling us again that this study is definitely worth, and the work that was coming out of it is worth going forward with it. And all of the physiotherapists agreed with this. I've got too many screens to be dealing with here. There we go. And so we need to be thinking about that when we're looking at collaboration. When we look at we're just doing fine time-wise, when we're looking at the recommended teaching and topics and techniques, the students actually asked for, the key things that they asked for were communication, compassion, empathy and dignity, which are covered in a quote that one of the students raised, that I think most training on my degree surrounding end-of-life care is based on the physiological aspects and not enough on the emotional aspects. Training around types of conversations, questions and situations that typically arise in people's and families' lives when receiving palliative care would be just as helpful and would make me less anxious. So again, it's that coming back to that holistic care that we need to look at. They wanted to look at symptom management, and that was brought up quite clearly in that physiotherapy quote earlier on. And they want to look at support and coping strategies. And that's providing coping strategies for staff as well as the person dying and their family and loved ones. Providing coping strategies for those who are dealing with this on a regular basis. Better access to help. And we worked very hard in the universities to offer this kind of support. Sometimes it's about getting the students to let us know that they need it, and us as qualified practitioners recognising the need it. And I think these topics reflect what the evidence calls for, and the techniques that they came up with for how to provide this education were simulation. And again, that came up high in ours. So students mentioned that the simulation class on carrying out last offices was helpful, but one of the respondents said that this didn't reflect their own experience. So the uni class on end-of-life care made it all seem peaceful, slow and quiet, where in reality it's everything but. And again, I know what class she was referring to there, and that's some of my colleagues saying, oh, we need to have dimmed rooms and quiet, softly, softly, whereas it's about this not hiding away from death and dying. And the students called for real life situations to be explored. So the learning is very academic. I don't think it prepares everyone. It would be good to include some real life experiences through guest speakers and media content. And there's lots of resources out there, and there's lots of people we can call for to be involved, whether it be relatives, charities, clinical experts, and kind of placements. The students picked up on the importance of placements for both palliative and end-of-life care, and areas they picked up on for that would be care of the elderly, community, and care homes, which is quite understandable. I think if we did a poll of us, we would come up with that. But also, one student mentioned that actually in the armed forces, they had experience of caring for the end of life. So that's not a placement area that we offer, but it is an area of practice. They raised a few, when we asked about that, they raised a few things that they would like us to consider. So that it has a sensitive approach, and we always try to give that. That a key aim should be reducing the students' fear. And that can we include this as early on in the course as possible. Now, we have been doing that in nursing, and one of their very first skills module they get in nursing looks at this, but we need to continue it throughout the course. And we want to look at doing that more from an interprofessional perspective for all professionals. There was also call for in-depth standalone modules on end-of-life care, but because, again, Sharon alluded to this earlier, because of everything else that we have to teach within these undergraduate programmes, that's really difficult. But postgraduate modules exist for nursing within GCU, and where I've worked before, we've had interprofessional ones. So that's something we would like to come forward out of this project. And the key challenge that we've mentioned over and over again is managing that gap between theory and the reality of practice. So the key themes from the students' perspectives was that we want to know what end-of-life care is, why it's important to learn about it, and that actually the staff and students and existing literature are all coming up with the same things. 70% feel they already learn about it as part of their programme, but they don't feel prepared to deliver it. So there's something missing, something we need to work on. Many students lack the confidence in their ability to support patients and their relatives. It can be difficult to understand how they're feeling themselves because it brings up thoughts of end-of-life care. For some of the students, this is the first time they've come across death and dying. And so we need to be aware of that. And there is a need and desire to improve education. And that people do want that to be from an interprofessional perspective. 95% of the students said they would respect that. So what now for the project? So what we're going to be doing is we're going to be mapping the curricula of end-of-life care to develop both uni-professional and interprofessional content, because we need to look at this across all the programmes. And we're going to work within this with interprofessional clinical specialists to make sure that we're meeting the needs across academic and practice settings. So one of the things I'm not sure that we've mentioned as part of the project is we've got a lot of our local practitioners, and we're having a focus group with them to discuss how we can take this all forward. And we're also thinking that actually what we should do is themed interprofessional study days from all of the programmes on end-of-life care. We want to support our practitioners to enhance their learning on interprofessional end-of-life care, because it's showing up that, you know, how can we train the students to do it if we're not all confident with it yet? We want to support the staff that are providing this topic, because it can be sensitive and hard and some staff want to step away from it. We also need to support the staff in teaching interprofessionally, and I've been learning a lot from doing this project about that. And we're also looking at increasing our links out to the medical school and University of Glasgow to do further work there. I think there's one wee point there. And all of this learning will enhance the students' employability, which is a key thing for us all. Develop knowledge, understanding, values and attributes. We're preparing for real work in end-of-life care and producing a workforce fit for the future needs and roles. So it is a really valuable thing to do. And just quickly, I know we've put thoughts there, but just quickly before we move on, we just wanted to share with you that part of this project, this was a whole set of projects that were across the university, and we had to feed back how that was for us as staff as well, and the impact and value for our academic roles. And for the team, we really enjoyed being part of the team and working interprofessionally and learning more things there. We've gained a greater understanding of what end-of-life care really means and a greater understanding of the importance of IPE education. And we have identified that the approach for end-of-life care education could be broader than what we thought of at first, and we need to open this out to all of the schools within health and life sciences, as well as other areas that we've discussed. Any further points you want to add, Sharon, or can we open it up to if people have any comments or suggestions?
No, I don't have any further thoughts. Caroline has put something in the chat. I'll just open it up. Caroline has asked, at the start of the presentation, one of you spoke about the spiritual aspect. Is this also part of your education? So I don't know if you want to take that from a nursing perspective,
yes.
Hazel?
So absolutely. Again, it's something that there's a lot of debate about and that a lot of people miss out. So whenever we're talking about holistic care, I am always going into the slides and the presentations and adding in that spirituality. I think there's a big, I mean, again, I don't know what everybody else thinks about this, but there's a big debate about what spirituality actually is. And we're still trying to come away from that, it just being about religion. So yes, we're working very hard on that. One of the exercises we do in the first year module for nurses is actually getting the students to look. We have a brilliant resource for spiritual and religious care, and we give the students case studies and get them to look at that and how would they support somebody of that spiritual or religious background. But the key focus being on, we don't expect you to remember all of this. There's resources there to go and look at, but we need to work much more on the whole spiritual nature of it, because that's what my doctoral thesis was about. So I'm good at bringing it back in, but it's about this collaboration and making sure that we're all focusing on that.
Yeah, I would add that for physio, we don't really cover that at all. You know, we do talk about cultural competence and come back to Hazel's point about religion and understanding that in relation to wants and needs of the service user, but not in any great depth. So I think for us, that's a real gap.
Yeah, I totally agree. When I studied physiotherapy, there was one lecturer and he had an example of a patient who had knee problems and couldn't knee while he was praying. And the importance of it, it's only once mentioned in the whole my whole physiotherapy program. So I think this is a missing thing, because We have to be open as a physio and a nurse because the patient needs help.
Yeah, I fully agree. Are there any other questions, or what are people's thoughts on the information that we've kind of presented today? Does it reflect your educational experience? Does it reflect your academic experience?
Can I
Do we
suggest,
have any-
please? Oh, sorry. Can I suggest maybe we can remove the shared screen, and then we can see everybody, whoever is willing to open the video. It's kind of a nice place that we can all gather and speak, if that's okay with you.
Absolutely. The presentation, I don't know if you're making it available at all, but all the references are at the end as well. So it's absolutely brilliant.
Okay, so you're willing, yeah, that was the question, one of the questions, if you're willing to share the presentation, the slides.
Yes, of course.
Okay, great. So if you can email them to me, and then I'll send them to the website, and hopefully they will put it together with the this webinar as well. So thank you very much. And I believe that there was a question on the chat box.
Yeah, so Duton is asking for, could he have different definitions of palliative care and end-of-life care? Hazel, you're probably best placed to answer that.
Hold on a wee second, I'm just reading it. At the beginning of the slide, showed a slide showing different aspects. Can I please have the definition of both? So you're asking for the definition of palliative care and the definition of end-of-life care. Yeah, so they're the ones at the beginning of the presentation. So I started off, just go into my alternate view of my slideshow. So the slides at the very beginning were, so the palliative care one was the Radbruch et al. 2020, where that's looking at, that's the whole palliative care. They've taken the old World Health Organization definition of palliative care, and they did a huge study about that. The reference for that is at the end of the presentation. So it would be really good to go and have a look at that document to see more of that. So that was the definition that talked about dying being a normal process, people living as actively as possible. The team approach, positive, neither hastening nor postponing death. And it should, that palliative care should be applied early in the course of illness, looking at the same time as the life prolonging therapies. Whereas the main difference really is when you come to that end of life care, is we're still looking at all of these aspects, but we're taking out those prolonged therapies and talking more about end of life comfort, symptom management. So they're very similar. And it's just looking at that. I don't know, does that help answer your question, or are you looking for some other definitions?
Hazel, hi, if I can jump in here.
Yeah.
Hi, this is Sheila Sullivan. I think it can be, I think the fact that there is an overlap, like I understand this gentleman's point, that in one of your slides and in one of the questionnaires, you had end of life care as being in the last year of life. So obviously we have the palliative care definition of what that is, and that can apply from, when somebody's diagnosed with a life-limiting illness, and it's meant to be, you're meant to be involved from the start, et cetera, et cetera. But there can be confusion, I think, then there's different use of the end of life care, so that some people can think that end of life care is the last few days, hours, weeks of life. End of life care is at the last year of life, and I don't know, has anybody actually still, it is confusing when you're talking, especially for yourselves now, designing a curriculum around end of life care. So you must have needed to, for your curriculum, put some kind of, have you put a time frame of end of life care, or because you could just be calling it a palliative care approach or whatever.
Yes, absolutely. So when we would say end of life care kicks in, and that's the problem of defining a time. And if we look at the theory about it, it says that it's when we see a deterioration in a person where we are saying, right, now's the time to be warning the family that death might be approaching soon. Now, in most situations, that's I would say from my own experience, in most situations, that's days. Occasionally it's hours. And when you're working in palliative care, that's horrible when it's hours if you think you can't get the family here if they wanted to be here. It's mostly days.
Yeah.
But
Right.
for some people, they go into that phase and then they come back out of it. And so
sorry, Hazel, I have to cut in there. Like, I know there would be definitions of end of life care for, you know, like nursing home care. Like, say, when I work in Ireland, so like our HICWA residential care standards and documents, like you can see end of life care being, again, not actually in relation to, you know, the final stages or weeks or ends. Like we also use the Peacock. I suppose we use the Australian Peacock palliative care outcomes collaboration definitions, and then I work in a hospice in Dublin. And then we talk about working hospice care. We talk using the Peacock. We talk about phases of care. So a patient will be entering the terminal phase. So that's specifically when you're working when you're actually working, say, in hospice care. Yeah, that helps us to know, you know, is a person entering the final days, hours, you know, of their life. But end of life care can be applied, like when I worked in nursing home care, residential care, the end of life care is used in those documents, and it's not imagining that people are in the last. It could be, you know, they're in their. It's just very. I think I don't know if anybody has quantified it yet. I don't know if anybody has actually.
Certainly in the Scottish literature, what we now see is the end of life is when it's, and the end of life, by end of life care, we mean terminal care. We mean that we notice that death is getting closer.
Okay, so you have to find it in Scotland.
And that is the challenge. You different people in different conditions would say palliative care, we're now in the end of life care stage of palliative care, and so it's been well, I've been working in palliative care now for 30 years, and it's been that same dilemma since I first started working in palliative care, is who defines it and who calls it what. So, and we went through a stage in palliative care recently, I was just noticing the time, sorry, that they wanted to stop calling it palliative care because the name palliative care frightens people. But if we call it something else, then people will just get frightened of that because it is a scary thing. So
I'm just sorry, because I know I'm just conscious of the time. What you're saying is that in Scotland, you're using definitions where like end of life care is approaching you're approaching the terminal phase, or you're approaching the terminal. But then I'm not understanding then why your curriculum is called end of life care. Would that not be, with the title of the curriculum that you're about to develop, be end of life care then? Because I work as a physio in a hospice, so like we are not involved in the very final days of a patient's life. I'm involved very much in the care, in the days, weeks, you know, and months leading up to those very last few days of life. Okay, so that's why the title of your curriculum then would almost be more like a palliative care. Sorry, now to throw that up at the very end of the lecture, but if you're saying that end of life care is the last few days and weeks of life, and I obviously work very closely with OTs. I work within the whole multidisciplinary team, but my role is not in the last few days of life ever.
Yeah, well, so I've worked in hospices before with physios and OTs who have been involved right in those very last moments, even sometimes, especially respiratory wise. But that's a thing for them. But you're absolutely right. And I would agree with you that actually what we need is a palliative care thing rather than an end of life. But the project had already started and was focusing just on that end of life bit. I think it's baby steps. It's about, if we can get that end of life bit in, then we can maybe look at how can we do the palliative care, and the palliative care aspect would be spread right across the curricula. So yeah, it just shows you how much this project can just increase, and we're really glad for your thoughts and points on that, and we will definitely be taking that back to the team and the wider university so we can get more funding to carry this on, won't we, Sharon?
Yeah, I mean, certainly one of the definitions on the slides I used was the Scottish Government definition that does, and it depends where you've picked these things up, but it does talk about end of life being in the last 12 months. So I can understand where Sheila's kind of
because I have read that as well. So I think it's important to get these definitions right, especially because especially in the context of student education, like we take students in placements in the hospice where I'm in, and I suppose like it is we hope to be doing in practice what you are And I don't exactly know what they have been taught in their curriculum coming out to us, but I will be exploring that. But they would find the on-site placement very helpful, of course. But the definitions, I think, are important because it does confuse people. Anyway, sorry, I'll stop there. Thank you very much, guys.
No, I think you're right, Sheila, and we probably as a team need to agree what time frame we are considering end of life care to be, so that we are clear with the students in relation to that. So it's a really good point. Thank you for raising it.
Thank you.
Are there any other questions?
So Sunday's asking if there's a virtual professional course on it. So watch this space. We're kind of exploring what courses are out there. So worldwide, there are lots of different courses about end of life care and palliative care. But we need a review and to understand that. One of the local palliative care nurse consultants has just contacted me recently about what is available in Scotland, and there's a bit of lack of awareness of that. So watch this space, because that's something that I'm going to start looking into Sunday.
Any other questions? No. Well, thank you very much. Thank you for allowing us to share our experience.
So Sharon and Hazel, I would like to thank you very much for providing this excellent presentation and in this for our organization. I think there are many questions. I think this is a really important topic, and people raised here really important and interesting questions about the definitions, because I think in Scotland probably end-of-life care and palliative care is something that is very advanced, but in some countries it's not. And I believe that maybe in different countries there are different definitions. Mm-hmm. So I think this would be a good thing to address, among the IPT-HOPE. But it's great. So we really appreciate that. Thank you very much. We will make sure to upload this presentation and the slides on the IPT-HOPE website. And that's it. Thank you very much again.
It's a pleasure. Nice to see you all.
Thank you. Thank you. Bye.
Bye.
Bye-bye. Thank you.